it's a different vial, it's a different dose, and so doctors will have a little bit of time to make sure that they understand the dosing, what syringes they have on hand, make sure they know how to handle the vaccine properly. And I know the immunization program has already, I just saw today an announcement from the program announcing some upcoming trainings from Pfizer on that for providers. In addition, we've got to get that vaccine out there, and the program's working very hard to get that, get providers who are interested and make sure they're going to have access to vaccine, working with the local health departments. So I'll turn it over to Sarah for more comments on their work.
Thanks, Dr. Hahn. Yeah, so we are working diligently with all our partners, especially the pediatric providers of vaccinations in Idaho, pharmacies, and our public health districts, of course, to ensure that we had the opportunity to pre-order vaccine that will be shipped in 3 waves after the FDA authorizes the vaccine for 5 to 11-year-olds. So what we'll have doses in the state ready to be administered as soon as CDC makes the recommendation, assuming that happens next week after the ACIP meeting. So after the first week of those order shipments, providers will continue to be able to order more vaccine as they need it. And the thing about the pre-order was that the minimum shipment was 300 doses. And after this pre-order phase, now that that's over, once those are shipped, when providers begin ordering on a weekly basis regularly, the minimum order will be 100 doses. So we do know that we've gotten feedback that a lot of our providers would prefer that smaller amount, and some of them are waiting to order that smaller amount. There are different storage and handling requirements for this pediatric version of the Pfizer vaccine. And so there is a shorter window of time to use it, and they want to make sure that they reduce a lot of their wastage and want to use the vaccine administer as much of the vaccine as possible rather than wasting it. So those are some of the things we know right now, and those are the preparations we're making. We do have, as Dr. Hahn mentioned, a lot of trainings for providers coming up, and there will be more after CDC makes their recommendations on the Pfizer pediatric formulation. And yeah, so we know that there are some family practice doctors getting family practices getting the vaccine. Our public health districts have ordered quite a bit. The ones that are serving as redistribution sites have ordered quite a large percentage, pre-ordered a large percentage, and then they break those packages up and distribute that in smaller amounts to a lot of the providers in their region. So some hospitals are about 1% of the pre-ordered doses are going to hospitals. And the bulk of it is going to public health districts and provider organizations around the state. And we do know that also, like Dr. Hahn mentioned, some of our chain pharmacies across the state are getting 12,000, a little over 12,000 doses